Hello, this is the front desk.
Good morning and welcome to another episode of the Cracking Backs podcast with your hosts, Dr. Terry Wyman and Dr. Spencer Barron. How you doing this morning, guys?
It's a good day, Lance.
It's great to hear. So today we are joined by Dr. Manu, Dave, Kacker, Dr. Kacker. Dr. Kacker has been practicing for the past 25 years in Westlake Village in Agora Hills, California. He is one of the only 400 dentists worldwide to be accredited by the American Academy of Cosmetic Dentistry. How you doing this morning, Dr. Kacker? That's what I'm going to call you from now on.
I am great, Lance.
Hey, you know what, Lance?
Doing well, thank you.
Just remember, Lance, he's your dentist. So there'll be a time when he's going to lay there. What'd you say about my name?
Well, he's already given me 2 fillings or 4 fillings and a bunch of stuff. So I'm getting back at him.
There you go.
Thanks, Lance.
Well, you know what, Doc, it's great to have you on the show. And a lot of people, usually when they go to, it's funny when you go to at your office yesterday, and they go to your office and you have all these distractions. You have these TV cameras, people can listen to music. So I just want to let you know our co-host is very distracted. His girlfriend just flew in from Michigan. So if you see him kind of oogling or kind of fading away, you know why. So the moment his eyes drift is the moment you hammer him. So just remember that.
Oh my gosh. Nothing is sacred around here. All right.
All right. Well, most people are going to wonder why we have a dentist on Cracking the Backs. And, when people think of dentistry, they think immediately of drills and cavities and horror and all that. And yet, what dentistry has done is done paradigm shifts across the globe of medicine. Let's just say that. You guys are always a leader in shifting things, and you shifted from cavities to vanity, and then from vanity to snoring, and I mean it's constantly changing. And so I want to know, how do you equate dental health with overall physical health and helping the body fight off disease? Because people wouldn't think of a dentist as a disease fighter. So let it go.
Well, thanks for that. Yeah, that's a great segue, Terry. But what we're seeing right now in dentistry is overall, what can we do to get wellness for the human or our patients better? And so wellness is kind of the starting point. And from a selfish point of view, you segued vanity and Airway and the TMJ. We used to, a lot of it's selfish. I mean, when we did these vanity cases to make patients' smiles look beautiful, the key for us was how do we make these things last a really long time? And the things that were really destructive to it were the Airway, was a TMJ. And so not managing those systems will actually screw up our cosmetics or our vanity that we're trying to get for these patients. Vanity is probably not the right word. It's just kind of, I would say, youthifying, getting them back to where they were, fighting that whole aging process. And so, I mean, with dentistry right now, I think the big shift or the big paradigm is, it all stems from this. When we were in dental school back in Chicago, back in the 90s and late 80s, the thing was our patient management strategies were based on patients living till they were 55 or 60. I'm starting vanity and cosmetic procedures on patients in their 80s. And the reality is we're living longer. We need these teeth to last probably to 3 to 4 more decades on average than what we were trained for out of school. So if we follow the old dental stuff that, the old classic teachings, we're just not doing our patients a service.
Well, it's interesting, the whole concept of dentistry and the evolution of it, because chiropractors use the metaphor of how dentists applied the principles of how taking care of your teeth before you get a cavity versus, or root canal or whatever it might be. Yeah. Take care of it now. And I started using that metaphor many years ago as take care of your spine like you do your teeth. So it was interesting, you know.
No, it's great. Yeah,
Yeah,
no,
yeah, yeah.
I'm
Go ahead.
sorry to interrupt, Spencer, but I was just saying,
No.
I mean, I think ancient medicine goes back to, if you look at this old, medical scripts, everything, even from the get-go, has been about prevention. And, prevention is a tricky thing now. I mean, there's a lot more complexity because we know a lot more. So what are we preventing? Old dentistry was preventing bacteria, well, bacteria is just one of the small entities that we're dealing with, when we're trying to do true prevention and stay ahead of the curve.
You know, it's interesting you mentioned that about prevention because it seems that prevention, not it seems, it is definite. Prevention means different things to not just different people, but different sectors of healthcare and the insurance companies. They'll say, "Oh yeah, yeah,
Yes.
go get a checkup and to prevent," but they won't cover real prevention. You
Yes.
know,
Yes.
yeah.
Yes. Yes. That's an ongoing battle. And,
Yeah.
I think you guys know this. I mean, for our patients to get exceptional well-being and, exceptional health and longevity, we got to go beyond the paradigms of what an insurance company would view as a preventative procedure, and yet stay with the science. Stay with the science. I mean, the science shows for patients, ultimately, if you can get their mouth alkaline, they're going to do well. And so, insurance companies insurance companies want to cover disease. So they cover progression, and progression is not really where you want to be sitting with when you're thinking of dentistry and the drills and the extractions and all the the nonsense that gives dentistry kind of that why have a dentist on the podcast or why talk about dentistry. It's a you know that's usually someone who's had to deal with something in a progressed state, and that's where if we can stay ahead of that curve for our patients or your audience, whatever we can do for that, that would be just a small step, and that's where we're headed, hopefully.
Hopefully.
Is I understand that breathing and or airways and you have a different perspective on that. So I would love to hear more on what you do or your revelation in dentistry that directed you more towards understanding airway and breathing capacity.
Yeah, no, so I think it started out when we were seeing instability in a lot of our restorative dental cases, or forget restorative dental cases, just on our patients' own natural teeth, the wear patterns, the clenching, and we would see them break down, and they're otherwise healthy patients, and they don't have gum disease, they don't have cavities, but their teeth are breaking down or their restorations are breaking down. And we would often equate that starting out with TMJ, but we learned slowly through some of the new imaging technology and things of that nature with CT scans, and as we got more knowledge on this, that there was definitely an airway factor, a breathing factor that screwed up a lot of things for our patients, and it's something we can catch earlier in when we look at the oral cavity in dentistry. I mean, when you go to your physician, they're not when from the lips to the back of their throat, they don't even look in that area. And that's kind of the area that we want to hit the prevention on. And airway is a huge portion of that. And I'd love to, as we get into the conversation, go into more details. But airway is truly significant in terms of stability, well-being, alkalinity improvement, but certainly, the biggest fear that we have with airway is, apneic patients that have apnea. I mean, that's a life-threatening issue. But the more subtle airway problems are, aging issues. They're anti-well-being issues if they're not being handled.
You just mentioned something about alkalinity. I have this real interest in understanding alkalinity, but and a more acidic body is a real medium for all sorts of bacteria and other disease states. But how do you look at breathing and alkalinity, and why is that important, especially in the mouth?
Yeah, so I mean, I think that, we're seeing over and over again the key in all our fields. Uh, that lend towards well-being and longevity is going to be anti-inflammatory or alkalinity. So
Okay.
inflammation is going to go into
Yeah.
acidity. And
Yeah.
so, we know from when we were kids, prevention on cavities and gum disease was really indirectly, how do we not get the mouth acidic? How do we get the mouth alkaline? But that was from the 1970s. We're in 2022 now. And so alkalinity is a huge direction of long-term well-being and stability. But alkalinity is basically not having inflammation. And that's what the goals are. And so, from a breathing perspective, dentally, what we're seeing is, you know, quick things to get you more alkaline right off the bat in a non sophisticated manner is just nasal breathing, making sure we've cleared up that nasal airway. And then there's a whole, obviously my wheelhouse is the oral cavity and opening up that airway. But
Mm-hmm.
that's a whole different segment. But breathing and proper breathing techniques, especially when you're sleeping, is just a tremendous step towards long-term alkalinity in the mouth, or long-term well-being, or long-term anti-inflammatory state of all the tissues in your mouth. Which segues to the whole overall systemic health that you're going to be experiencing as you get older.
Okay, so I have two questions about that because one is, how well, how do you get people to breathe through their nose? And then number two is, how do you suggest people test for whether their body's more acidic or alkaline? The only way I know is to get those pH sticks from the pharmacy and pee on them and see. Do you have a different
Well,
approach?
Spencer, those actually work. But actually, you can often tell even before you see your dentist. If I'm feeling acidic, sometimes it's a bad taste, sourness. There's things you feel, or all of a sudden you're getting cavities, or all of a sudden you're receding more, gum disease. I mean, there's little things like that. But more to your point in terms of, I think you're hitting upon a big thing that's important, and really some simple prevention is, we were talking about the nasal breathing. And I am telling you, for all your listeners and even to my patients, when sometimes they're thinking, God, treating, sleep issues or reconstructive dentistry and all that gets so pricey. But, I'll tell you one step that all of our patients can take with a little bit of supervision from us or you guys is a technique of mouth taping. And you and I have talked about that, I think, in the past. But mouth taping, as ridiculous as that sounds, it's going to confirm that you're nasal breathing. So if you're having difficulty sleeping with tape on your mouth, that's a big indicator that you have some possible nasal obstruction, which, for our listeners out there, what we're talking about when we talk about not getting nasal oxygen when you sleep means that you're getting oxygen probably from your mouth, which is basically unfiltered. I mean, think of it like your nasal airway is
Mm-hmm.
like pure mountain spring, beautiful alpine water, and your oral airway is basically Flint, Michigan on its worst day coming through the tap. So it's like, sorry, Flint, Michigan, but I mean, it's just it's a different level of quality of, and that has a lot of influence on hormones, well-being, sleep, alkalinity. So these are the things where it goes full circle with that. So I honestly, one tip, if anything's worthwhile from this podcast, is tape your mouth when you sleep.
Hey, Doc, I got a question because, when you told me that, I came home and my wife just took a roll of duct tape and just wrapped it around my face. So
I could see Michelle doing that.
yeah.
Yeah.
So is that the proper way to do it? When you say tape someone's mouth, do you just like shove a sock in there and tape it like they do in the movies, or
No, I
is there
mean,
another
Terry,
way
I
of
know.
taping it?
I know what Michelle was after when she did that to you, but no, for honestly, guys, the mouth tape. There's a lot of different thoughts on it. To me, mouth taping, make it real simple, unless you need more supervision or a different reason. But as a starter point, you look at like a piece of tape the size of like a Charlie Chaplin mustache. So kind of like in the middle of your lips. So right where your philtrum is, like if you were to draw a line and you divided your lip or your smile with your lip closed into thirds, you want to cover that middle third with
Mm.
tape, and that's it. You don't need to cover the whole mouth. It's a small piece just to kind of get the tape right here, like a Charlie Chaplin size. If you drew it all the way down from the upper lip to lower lip, and you know
What
what,
kind of tape?
yeah. So I'm not partial to anything specific, but on Amazon, if you Google mouth breathing tape, the
Hmm.
product I am using is by 3M. It's a medical tape. It's easy to peel on and off.
Hmm.
It's not too sticky. I think that's an easy tape for us to start. It's $8.99 for a roll, meaning you could go about 2 months, 3 months of everyday mouth taping with that.
Oh wow.
So it for for what, $8.99 for 3 months of treatment. I mean, that's a pretty good deal,
Oh,
and
that's good. All right.
and it will improve your well-being. So I mean, mouth taping, keep it simple, Terry. Yeah,
Yeah.
people get really freaked out about it because they think they got to like duct tape seal their whole lip. No, it's a little seal in the middle of your lip, and just start with that. Go a couple nights, and if you can't do it, you need to see your practitioner. You have to,
Got it.
because you
Yeah.
got to get that airway cleared out.
I mean, that's kind of why I had to grow the mustache and beard to hide the scars. Yeah, so, yeah.
Terry, you're more than welcome to use the whole,
Yeah,
tape. I mean, even during a show would be fantastic. No, kidding, Terry. But actually, all kidding aside, Terry, didn't you call me the other day or text me the other day about this mouth breathing thing, and you saw some, warning on the news about? Was it you who
No,
told me
that was obviously your other friend.
Oh, I do have
Two.
friends somewhere here, but no, but there was this I guess somebody I was talking about the whole mouth breathing thing and how to prevent and put tape on, and then on Instagram or something, or some there was some conversation about, can you imagine that there are people out there putting tape over their mouth at night when they sleep, and it was made it without explanation. It made it seem
Yeah.
like it was the new fad.
Shocking. Yeah, when
Yeah.
that was on social media, shocking.
Yeah. Oh wait. Karen told me it was a TikTok trend.
Oh,
That's what it
shocking.
was.
God.
Yeah, shocking.
There you go.
Okay.
First you put tape across your whole mouth, and then you put a white strap on your neck and you yank it. That's how you get ultimate
Yeah,
health.
yeah. That's a good TikTok there, Terry, because that'll yeah.
There you go. Hey,
Um,
another thing that people don't think about the dentistry is you talk a lot about tongue posture, and I had never heard of tongue posture. So what's that all about? Because I know that
Yeah.
you just said from the lips to the throat. So
God, I love talking to you two guys about posture because you guys, that's like okay. So, but I think you guys know this. I know you both know this, of course, but with posturing, one of the things that we're seeing is, it's very undiagnosed and very unidentified by a lot of practitioners is a tongue tie, meaning what
hmm,
we're seeing is, and this will affect your posture, your neck, neck pain, airway. So tongue tie is just a thing where you can't lift the tip of your tongue to the roof of your mouth. So, you want to get that checked because a tongue tie can be a quick, cure to, airway issues.
hmm,
If you're tongue tied, your tongue's going to the back of your throat and it's blocking your airway the second you lie down. So unless you're sleeping standing up and you're tongue tied, that could be a huge problem in terms of airway. And it's a real simple fix and actually a real simple diagnosis. You basically, want to just open up your mouth as wide as you can and if you can't stick the tip of your tongue to the roof of your mouth, you're probably tongue tied. Nice, Terry, you're not
thank
tongue
you,
tied. Yeah.
Spencer. Don't say anything.
I really worked hard at restraining just now. But go ahead.
Yeah, you'll be rewarded for that, Spencer. But I think the
Yeah.
thing is, the tongue tie. That's something that is another real quick fix for a lot of our patients that don't want to get involved in
Mhm.
a long term treatment plan. You eliminate that, you're going to see airway improve. You're going to see posture improve, alkalinity, acidity. This all goes hand in hand. But tongue tie and subsequent myofunctional therapy is what we're calling it now, which is you're getting, you're using the tongue, especially if you can relieve this early on kids. You're going to see much better facial development. better looking.
Wow.
I mean, and the reason that we say the better looking, you know, faces is because the faces expand a little bit. They're wider. They got that look that people are spending a ton of money on when they get older. And so relieving that tongue tie sometimes at that right time will really help open up that airway, develop everything facially. And if you're already developed, there's still huge benefits for relieving the tongue tie.
So
Wow.
there's really such a thing as tongue tied. I thought it was just when people trip over their words.
Well, no, that's a different one, but that's a metaphorical tongue tie. And we know people who do that pretty well.
Yep, yep. Oh man. Well, all right. So I think what we're going to do is we are going to step into the realm of rapid fire questions.
All
This
right.
this seems to be a crowd favorite, but we're going to go ahead and I'll tell you.
At least our crowd.
Yeah. Well, yeah. Right. So, Dr. Kacker, I'm going to throw out 5 questions, one at a time. Answer them as best as you can. You do have the answers. Just let's see how quick you are on your feet.
Oh
You ready?
boy, early in the morning, Spencer.
Question number 1, which is my favorite. I heard you're a photographer, so what is your favorite camera?
Oh God, Spencer, I have a favorite, the A7R by Sony. It's that mirrorless system. It's awesome. It's great technology. Photography. I mean, if you're a photo enthusiast, I love that. And obviously with the cosmetic dentistry we do in the practice, I have a whole setup for face shots and teeth shots and all these beautiful before and afters. For that, I use my Canon because that's like I'm in work mode. I want to be. But as soon as I put that Sony in my hand, I know I'm somewhere beautiful and I'm having a lot of fun. So
Oh, that's
I'm going to say
awesome.
the Sony.
All right.
No Nikon.
I mean, look, the lenses are amazing, but technology on Sony is just hard to beat. And the
Yeah, that's true.
Canon, man, that's been classic in the practice for like 25 years. So can't change that.
All right. Question number 2. What is the one single biggest mistake people make when it comes to their mouth?
Not flossing. Not flossing. Because that is the cheapest prevention. And can I have a second to tell
Oh
tell
yeah.
my little flossing
Yeah.
story? Because this is something I try to make sure every new patient of mine knows, and every active patient of mine knows, and every friend of mine knows. Because when I was in dental school, look, I thought flossing is just to get the junk out in between your teeth. And we had a little bit of a conversation about alkalinity, acidity, and our goal is to make the mouth alkaline. Well, the biggest culprit in not being alkaline, besides whatever causes that inflammation, are these what we call anaerobes. That's our fancy word for bugs in the mouth that survive where there's no oxygen. Well, guess where that is? That's in between your teeth. The teeth, where the teeth connect, there's no oxygen, there's no air. So that's where the bugs start. Those x-rays that we take called bite wings that you get all the time, we should call them flossing x-rays. That's our way of seeing if you're flossing. Flossing basically gets air in between those non-air spots where the teeth meet. So you put floss in there, you're just making an airway channel for oxygen, and that obliterates that bacteria. It obliterates that. So I would say that's the number one cheapest thing. That little string of floss. If you come to my office, you can have it for free anytime you want, and a lot of your dentists will be happy to give you that. And you know that on Amazon, God, what is that? $1.99? I mean, that's a no-brainer. That's a no-brainer.
Oh, that's great. Great information there with the flossing. I didn't really realize that. Okay. So, although I do floss, what
Good, good.
is now number 3? What is the best trick to help someone stop snoring, as long as it's not a serious condition?
Yeah, for snoring, look, obviously, like you just said, as long as there's no underlying apneic issue, okay, and we're snoring, let's say there's cosmetic snoring. I actually like a new technology, the erbium laser by Photona is a laser actually, and this puts kind of a non-ablation uh, heating on that, what I call that wiggly turbulent tissue that you hear when you're snoring. And what it does is it tightens up that tissue and starts producing your own collagen, and that wiggly soft tissue kind of retracts towards your hard palate, opens up your airway, and we see a lot less snoring. So I think that's one of the most simple treatments. You can use it on apneic patients, but I haven't seen the metrics on it long enough that I would say that would be a long-term permanent solution for, sleep apnea. It's helpful, but it may not get you out of the CPAP or the dental device. But we're seeing some promise there as we get better with the technology. But that's new technology. I like that a lot for snoring treatment.
Mm, love this. Love this. I understand you're a whiskey connoisseur. So, I want to know what your favorite bottle is.
Well, I mean, I've had some fun ones with Terry for sure, but I would
Of
say
course.
right now, my new favorite, Tomatin 30.
Tomatin.
Just had it the other night. Tomatin 30.
Mm,
It is
What?
fantastic. Yeah, I know, Terry.
wow.
I threw you for a loop there.
Yeah.
Uh, this I've had a lot of favorites, but this one I had a recent experience with it, and it was just I had to I took a double take because I've had
Wow.
some good ones, but this one, uh, it's exceptional.
And you
It's
have this at
exceptional.
your house?
No commentary
Yeah, because I
Okay.
know what's coming next.
because I know
I'll be over tonight.
I'll be right over.
I think I saved you a dram, Terry, for sure.
Have you thrown axes with Terry and
I
whiskey?
have, I have, man. That was brutal. Terry
Okay.
kind of schooled me on that
Brutal.
one.
Oh, I think you won a few games there. It was fun.
Oh, no, that was a lot of fun.
Question number 5. Best toothbrush.
Best toothbrush. You know what? My answer on this is always this. I really don't have a favorite as long as you switch it every 3 months. And I like a soft toothbrush. So, like a soft toothbrush that you switch every 3 months. Now, you can use any of the electric toothbrush, whatever's I say whatever's at Costco on sale, Oral B, Sonicare, they all work. The key is just changing that head on the toothbrush every 3 months, and you're going to be good.
Now, do you
That's
like
good.
electric versus a manual?
I think in general, I like electric better for most patients. For
All right.
most patients, they're going to do better with the electric.
All right. I have a number 6. Best
Oh,
neck and jaw exercise.
best neck. Oh my God, Spencer, that's good. Um, so honestly, I would say the best neck and jaw airway TMJ improvement exercise
Hmm.
is you use, I it's like when you're running. You want to warm up a little bit before you stretch. You don't just stretch. You get a little bit of heat in your muscles and then you stretch. So for the TMJ or jaw and neck and tightness there, put a heating pad on. So let's say your right side's bothering you more than your left side. What you need to do with that is heat up the right side first, the side that's afflicted. Heat it up with a heating pad or a warm towel for 5-10 minutes. Left side, 5-10 minutes. Go back to the afflicted side for 5 or 10 minutes, and then just stretch open as wide as you can, 5 to 10 times. Do that once or twice a day. It does a lot. It increases kind of what we call the synovial fluid in your TMJ joint. It really helps with lactic acid that builds up in some of those muscles. And so really quick home physical therapy it's a good starting point for a lot of myofascial pain, TMJ pain.
Oh, I love it. Um, you know, I got to throw in one more rapid fire question.
We're going to be
And
rapid fire for the
I
whole
love
thing.
it.
yeah, right. And it's only because you are so worldly and have so much information. And
Yeah.
I think I'm
Oh,
just gonna
Spencer.
tap into one more thing. They always said 4 out of 5 dentists surveyed recommended Trident gum. Who was that one dentist that antagonized the whole
Right?
commercial?
Oh my
Yeah.
God. Now we
I've
got to
always
track
wanted
him.
to ask that.
We got to track him. Absolutely track him down. Oh
Oh
God.
yeah,
Oh, that's
man!
good, Spencer.
What a
It's
dissenter,
so
man!
funny though. These
Jesus.
stereotypes of dentistry, they exist for a reason. But we got to change it because there is so much more we can do to improve overall well-being and health by just having someone who's a little bit more progressive, who's looking at, you want to look at your patient, and you guys do this, and I know you know this, but when you're looking at your patients through the scope of an insurance company, you're just not going to get them there. But when you look at your patient for who they are as a human, and you really try to get them healthy,
Yeah.
doesn't mean you have to make them spend money. There's so many tricks to getting them just healthy on their own. And once they start getting healthy and motivated and they have the means, you can always take them to the next level. But there's some basic things that we just talked about today that would really, anybody listening to this, it's going to improve their well-being. And I
Yes.
mean, it's we talked about it. Start with the mouth taping under some supervision, but certainly you can do it on your own. There's plenty of information on that's good information out there. But mouth taping, we talked about flossing, and getting yourself alkaline. These are all the keys to starting that whole well-being process where you're not stuck in what's going to happen based on old paradigms of dentistry where you're going to live past 55, you want those teeth.
Yeah.
So
Yeah.
let's do it.
Love it.
I think that one dentist Spencer went to Chiclets and it pissed off
I think
Trident.
I think it's paid off by
Totally.
one of these companies.
Yeah,
Absolutely.
Bazooka. He was
Yeah,
paid
there
off
you
by
go.
Bazooka.
Bazooka.
Hubba Bubba, one of those. It was
Comic books and Bazooka.
another gum company, and the guy goes, "Screw you, Trident. I'm going that way."
Comic books, Terry. He was a cheap sellout.
That's right.
The
Wow,
Bazooka.
that's
Remember
so
those?
funny.
Man, I
Yeah.
love those.
And
That's
who doesn't
right.
like Hubba Bubba? I mean, come on, the bubbles you grew, yeah.
Well, Bubblicious. There was
Bubblicious.
Bubblicious.
Oh, let's talk. Let's just go gum. Who has the best gum out there?
God. Oh man. I think that fourth out of fifth dentist, or that 1 out of 5, he had the secret though. He knew something.
Yeah.
So
Yeah.
that's actually an interesting question because do dentists like people chewing gum? I mean,
Ooh.
Yeah. So good question. Look, here's the thing. You got to look at you have to look at the gum. I mean, there's so many good sugar-free gums out with xylitol. Xylitol is helpful for people like with dry mouth. So there's people with certain meds. They're
Wow.
cancer patients. They've gone through a lot of stuff. They're dry mouth. I like some
Mhm.
of these xylitol products for them.
Mm,
It increases saliva.
Interesting.
Saliva, we didn't even get into that, but proper healthy saliva. It's great buffering. It has a lot, again, anti-inflammatory properties. So look, for someone who's got certain conditions, dry mouth particularly, these xylitol gums are beneficial. Now you got to trade that off with someone who's got a TMJ problem, a
Right.
joint
Right. Right.
problem. Now they should still be able to chew gum, but after proper therapy for the TMJ, that would be my only patient that I don't think should be chewing gum is someone with an actual joint problem. TMJ is the elbow of your head, the joint in your head, and
Mhm.
those type of patients don't do well if they're chewing gum. And obviously, I don't like gum with sugar in it because of selfish.
Right.
You're gonna, especially young patients, they don't do well with that. They get cavities. I mean, that's just
okay.
paid off by the American Dental Association somehow.
So staying on that same subject, what is the biggest cause in your opinion of bad breath, and how's the best way to get rid of it?
Ooh.
I look, bad breath dentally is pretty easy to solve because if you don't have old fillings, leaking crowns, and that kind of thing, you don't have gum disease, you're all the stuff that we talked about getting you alkaline, you're not getting bad breath from your mouth. And it's got to be a GI situation. You got to look at the gastric situation for the halitosis at that point. And that's a different, topic. But again, things you can do on your own to help with that are getting the oral cavity alkaline first. And so like bad breath in the mouth is going to usually be a cavity, gum disease, old filling that's breaking down or crown. That's where you get the bacteria kind of stuck in there. That's an easy solution. And once that's solved, if you still have halitosis, you got to look maybe at the you have to look at it from a gastric perspective,
Mhm.
GI.
Interesting. And I love these topics because it's what's on everybody's mind, but it's also kind of what people don't think of dentistry for. And I kind of want to go back to one of Spencer's rapid fire questions to get a little deeper in it, and that is the snoring issue. And a lot of people think of snoring as a mouth guard or those huge sleep apneas, which isn't really good for relationships, having these big machines in the bed with you and all that kind of stuff. So, can you go a little deeper in what you've seen the progression of science in helping people with snoring?
Yeah, no, so snoring and sleep apnea, if you take it as a whole, you know, if you combine both issues, got to get the apnea under control. So the apnea, just really quick for our listeners, is you know, apnea, we describe it as a cessation of airway. And that airway cessation is measured in units of time. So it's like a weight. What we're looking at with apnea is from a medical perspective, there's a thing called AHI, or apnea hypopnea index, and that index is kind of like your weight, or it's something, or blood pressure. It's something we can measure. And so apnea is something that we definitely want to treat, because we stage apnea based on, like, there's mild, there's moderate, and there's severe apnea. So someone who's even a moderate apneic patient and it's not treated, uh, our stats are showing you're going to lose about a decade of your life. So yeah, so
Whoa.
it's a serious problem. So apnea is something, as soon as you realize, or you're diagnosed with some form of apnea, you want to grab that bull by the horn, because it's something that's treatable, and it's gonna extend your longevity, the quality of your life, and it starts. A lot of times with our apneic patients too, you get them off that apneic cycle, they get energy, they start doing really well. So it kind of becomes a self-perpetuating thing for well-being. They lose weight, they get healthier, and it progresses in the right way. And the apnea was just slowing them down. So apnea treatment's huge. I mean, nobody likes a CPAP, and nobody likes that big bulky dental device. But as of right now, on moderate and advanced stages, you kind of need to start there, get it under control, and there's other things you can do, so it's less intrusive. We were talking a little bit about the photonal laser, Terry. That's really cutting edge technology. There's a procedure called the night laze procedure, which really helps open up the posterior, the airway from your mouth, improves the airway substantially, reduces apnea, and it's definitely showing promise. But with true apneic patients, I like to make sure we're getting the apnea solved. Uh, but with snoring patients without apnea, they have a lot more options. You can treat that. That's an earlier stage problem. Cosmetically, to help your bed partner, there's things you can do for snoring. But I would start with mouth taping, then progress to some of the more advanced treatments.
I'm going to switch gears on you and talk about receding gum lines and things that, as we age, we start to notice that those could be a problem. But a dentist patient of mine told me about this gum. It used to be a graft, but now, or alloderm or something like that. But then
Oh
then
yeah,
there was the gum. He was telling me about a gum lift of some
yeah,
sort, where I thought, wow, that's intense. Can you
intense.
elaborate on?
Yeah,
Yeah.
sure, sure. So gum recession, basically gum recession, is something we'll see where the pink tissue, the pink part that you think of the gum, starts shrinking away from your tooth. So it exposes, it makes the tooth look longer. For some people, you can get a lot of sensitivity with that, or some people it just looks bad. And so with treatment on that's usually going to be, if we think it's going to progress more, where you're going to lose a tooth. Because think of that gum as like a blanket. It's our first line of defense. And as that blanketing around the necks of the teeth start going away, chances of what we call an abscess or infection there is higher. And so treating recession is it's treating there's two types of gum lifts. There's a pathologic reason for treating it, where we think the pathology is going to get worse, meaning you're going to lose a tooth, and you can do a lift or a graft in those circumstances. The criteria that I would use on that, just generally, if you're not getting a true diagnosis, would be, if you're real sensitive, it's something you want to address possibly, and if the gum keeps shrinking, that's a big reason. So that's something that you want to get monitored for sure. The gum lift that you were talking about is, often we'll do that in cosmetics, for example. So the gum lift, sometimes teeth look a little bit short or small when you're smiling, and there's actually teeth underneath that part of the gum, the white. So you kind of lift that gum up, and it's a cosmetic procedure we'll do to actually make the teeth look longer and fuller. So we do that a lot. Now that, when we do it for cosmetics, you're not treating pathology tissue. So it's something that's kind of like a cosmetic procedure. It's not as intense as you would think. It's actually real easy. Patients do really well. Your downtime zero. But we're treating pathology, meaning the gum recession is causing a potential progression of tooth loss. it's a little bit more challenging. It's a little bit more intense. And alloderm that you were talking about is there's two types of grafts that we're using to, replace that missing tissue. One is autogenous grafting, meaning we're using your own tissue to place it back in and replace that lost tissue. And that's great because it looks like you, it feels like you, it's your own tissue. The downside to that is you can only do small parts because we get that tissue from the roof of your mouth. So we're doing like a real small area. I know. I'm sorry, I'm grossing you out here. We're
No,
going
no,
back
it
to old
hurts. I
dentistry.
just no, it just hurts. That's why I
And
can't imagine.
alloderm is a newer technology. It's a little bit. I like it a lot with the right technique. But alloderm is basically artificial skin that is like a scaffolding where you can graft the whole mouth, and it's quicker. There's less surgery. It holds really well, so it has some great indications. It's not what I like cosmetically if the gum's showing. So like but in certain areas where we're dealing with pathology, alloderm works well. So I mean,
Hmm.
this is stuff that's advanced. Again, we don't want our patients there, but that is the solution.
Speaking of pain, I mean, I can't imagine grafting from the soft palate. I mean, just that alone, that's why I was cringing. But
I know.
yeah, speaking of pain, we in the chiropractic profession, those of us who are conscientious enough understand referred pain. Referred pain, you have pain in an area, but it's coming from another source. And what I'm leading to is, do you sometimes see patients that come in with tooth or jaw pain, and you realize that it may be referred from, the scalenes or the SCM or any of the muscular?
100%. Oh yeah.
Okay.
Yeah, I mean diagnosis, as you know, in your field and in our field, is the key. Proper
Mm,
diagnosis on any problem is the starting point. And referred pain, often will be masked. I mean, I'll tell you the most common masking of referred pain is actually temporomandibular joint pain that
mhm.
tricks us into thinking it's an ear or sinus or a toothache, and it's
Yeah,
actually the joint. So it's
yeah.
clenching pain that's not a tooth problem. And this is again where more, you don't want teeth having endodontic treatment or root canals on teeth that are falsely referring pain. I call it a false positive. So diagnosis on that is huge. And yeah, we see referred pain all the time. A very common one is it feels like the tooth pain is from the bottom and it's a top tooth. It's got an endodontic infection. And so again, like in your field, getting that diagnosis right from the get-go is the key. And referrer can trick all of us. That's why you need experienced diagnosticians, like guys our age that know what we're doing. No, I mean, joking aside, the diagnosis is the key for this. It really is. And referred pain, you know it's not always a misdiagnosis by the practitioner, but we do see that a lot. It just kind of masks itself as, instead of a toothache, it's actually a joint problem or a sinus problem, and that's where you have to really spend the time with the patient, make sure you're getting to the right, literally the root of the problem.
On that topic, I've actually started referring people, to you for when people have no pain, but they've almost like lost energy and they just feel like they're very lethargic. And sometimes a mouth infection is below the threshold and you don't feel any pain. It's not picked up in blood tests, it's not picked up in stuff, but you have this low grade infection that's from the mouth that affects the entire body. Can you talk a little bit about how a low grade infection can cause that, and
Yeah,
why once a year is probably not the best thing to see a dentist? It's probably a little more often, but how
yeah, no,
low grade infections can
sure.
affect the whole entire body?
Yeah, yeah. I mean, so with chronic and low grade infection, like you're talking about, Terry, especially in the mouth, we're almost used to it. Our body can handle that chronic. That's why, like gum disease, I always say it doesn't hurt. When it hurts, it's too late. So, gum disease, you can live with gum disease. You can live with diabetes. These are chronic autoimmune diseases. And so what happens is your body gets a threshold where it can handle living day to day with that low grade chronic infection. And like you said, sometimes you'll pick up things, and I have seen you do that, where you pick up a fatigue issue, and it is related to an constant, it doesn't hurt. You can do what you got to do, but that it just takes a toll. Your body's constantly fighting that low grade infection, where it could be doing other things. And so that goes back to our earlier conversation. You get that mouth alkaline, that low grade chronic infection goes away. And I know you're like with Terry, you're always ahead of the curve and you love being innovative and you like thinking outside of the box and what can I do to get my patient better? What can I do? I've talked to you about this for 25 years. You're always looking in that direction. And you and I talked about this, with one of the things that we're doing, like, what's evolving with even airway problems. And we're treating these patients with, we're treating patients when they're diseased. It's a different thing with what I do because I do a lot of cosmetics in my practice. So when I'm doing cosmetics, I'm not treating disease. I'm treating elective wanted procedures. And those go really, really well. And patients love it. And they pay for it. I mean, I tell them it's your vacation or your teeth, you got to choose it. It's not, there's no right or wrong here. You don't need to do this. But if you do it, it's getting that fancy, like put it in Lance's term, a nice dirt bike or something brand new that you really want. It's not something you really need, but it's gonna, I've never done a case where the patient didn't tell me 10 years later, I'm so glad you made me do that, or I did that with you. I'm going off on a tangent here, but what we were talking about, Terry, is, over the years, you and I have talked about this. If we can treat our patients when they're not diseased, they just do better. They just, you keep them ahead of the curve. And so I'm going to give you some examples in modern dentistry right now. For example, we were talking about when we're always treating apnea, we're treating disease. But like that laser solution that we were talking about, this newer technology, I like treating, I have this group of bikers here in Westlake that, there's one patient of mine. He's always They're a group of 15 or 16 guys. They've been riding together for like 18 years. And they do their road bikes. He's always 15 or 16 or 17 or 18 out of that group. And he's known these guys and he's fairly fit and does well. And, I actually did he did not have sleep apnea, but we just did it for fun. We put the laser back there, opened up his airway a little, got rid of his snoring. And we were monitoring with this thing called an aura ring, and his metrics improved like crazy. His oxygen saturation, hydration. He called me up, goes, I came in third. I was in third. After 20 years, he couldn't even break the middle of the pack. He came in third on the bike. We kept doing it. He's been in the top 5 for the last year now. And these are guys that he's been competing against for, I mean, you don't improve like that. That's a huge improvement in that kind of study. But I'm treating a healthy patient that just wants an enhancement. We're not waiting for him to get disease. And, we're seeing this stuff, even, something that's really popular right now with TMJ treatment is Botox. These neurotoxins. We didn't even talk about that. But, I have patients where we'll use the Botox to get rid of myofascial pain, improve TMJ function. I will tell you a lot of the patients like it because of the, thins out the face and makes you get kind of thins out that heavy, bulky muscle. But it also, removes lines and things like that. But I have patients that have told me they started early and they just don't want to see the lines. They don't want to see that. And I'm not advocating that by any means. But let me tell you, these patients are thinking in the right direction. Why are you waiting for disease to take action? And I know in your field and certainly in my field, we want to treat these patients before the disease progression. And that goes back to what we started this whole conversation about. What do we do about prevention, alkalinity, non-inflammation? And that's going to be the future of all our fields.
I got one last question before we close, and that is mouthwash. So you hear, when I was younger, it was Listerine, and when you put it in your mouth, you felt that tingling. And of course, my father used to say, "Well, that's the antiseptic working and clean out your mouth." And then it was Scope, minty breath, and all that kind of stuff. What's your thoughts on mouthwash to close?
All right, Terry. So this is interesting. Now, mouthwash, pros and cons. I don't like anything that disrupts your natural oral flora. Okay? So we all have our own immune systems, our own little microbiology. Okay? And the more natural we can keep it with little tweaks of getting you more alkaline with whatever, because we can pick that up as, experts, but we still want to keep you as natural. What happens with scope, not picking on scope or Listerine, but they're like, it's like a bomb in Vietnam that just knocks out the whole village. Okay, it just kills all the bacteria. So, some people will do well with it because that part of the flora needed to be disrupted. But some people do really bad with it because it's like taking antibiotics for too long. Your body's own immune system doesn't respond as well. So you got to look at the flora. Sometimes I look at mouthwash as a mask. I'm not saying it's right or wrong. It's kind of an individual thing. But for the purpose of the podcast and just giving general advice, look, mouthwash, flossing, brushing, all that's going in the right direction. It's just what I'm saying is if you really study mouthwash or something that's just that obliterative of the flora, there could be some pitfalls that I want to, people to think about. And you can see your practitioner and they'll give you some, more custom advice on it. But I would say I'm kind of in the middle with mouthwash on that one. I'll tell you real quick, for my average patient, you dilute a little hydrogen peroxide in a glass of water. You foam that up. You kill the anaerobes. Forget the taste, the mintiness, and all that. Do that with something else. That's going to be the most effective in keeping you alkaline and not letting your flora get too disrupted. That's my take on it from a holistic perspective.
Totally doing that. Because, I'm a Listerine user.
And again, I'm not trying to cut back on Listerine because it works in certain circumstances when we really need to be aggressive, but it's really kind of laying out a mass, where your flora can never really recoup. Yeah.
Right.
I actually got an ulcer on my tongue from using the Listerine after a period of time.
It's strong stuff. I mean, it's and it's got a lot of ingredients, and that's a whole different podcast. But boy, I'll tell you, I'm not against it, but I'm not a fan.
Understood. And for some reason, I have a throwback commercial. Scope once in the morning does it. I remember that Scope once in the morning does it. These
insurance companies made up the 6-month recall. That's what they covered. 6-month recall has no scientific basis, but we use it because some insurance company came up with it in the 1970s. So patients do great when they do a 6-month recall, by the way. I'm not saying, but statistically, it's actually wrong. We've seen that now in medicine. If you're over 40, believe it or not, a 3-month recall, if you really want to be keeping the longevity and you want to be preventative. That's a whole different conversation, but we talk about what gets publicized and what's true in science, and there's sometimes a discord.
Well, I'll tell you, in closing, you've left us with some really, really super cool little tidbits of information from flossing, from alkalinity and breathing patterns and TMJ and referred pain and all that.
And tape in my mouth.
This has been exceptional. I really appreciate you for all that.
Love talking to you guys. Thank you so much.
Yeah, same.
All right, brother. Go do your wedding and whatever you're going to do. I know Spencer's got something planned for the next hour or so.
Of course.
Have a good time, buddy, and thank you always for joining us.
It's great seeing you both. Bye, Lance.
Thank you for listening to today's episode of the Crackin' Backs podcast. We hope you enjoyed, and make sure you follow our Instagram at Crackin' Backs Podcast. Catch new episodes every Monday. See you next time.